is Shirley, and I am a stage 4 triple negative breast cancer patient. This blog is to help other triple negative patients in the same boat as me, to see what it's like, someone that's maybe farther along in their journey than they are at the moment. So I'm quite early in my journey. I currently have a pretty low cancer load and I'm doing really well. But I really enjoyed watching other people's vlogs that were farther along. That's what I want to do with this blog. I want to show you what can happen to you as your cancer progresses, and what kind of complications and what kind of surgeries and what kind of things will happen. And it just helps you make decisions in the future. So that's my goal. So hopefully this is helpful. My plan is to just take you through my life, show you what it's like to be a stage 4 breast cancer patient. So I'll take you to chemo, I'll take you to just activities that I'm doing. So my story starts in 2012. It's currently December 29th, 2024. And in 2012, my doctor found a lump in my breast during a standard physical. So I went for a mammogram, ultrasound, biopsy, and oh my God, the biopsy was so painful. It was one of the top 3 painful things in my life. Anyway, and sure enough, it was cancer. But they didn't know what kind at the moment, but wanted to get me in for surgery right away, as they suspected it was triple negative, and triple negative isn't a particularly aggressive cancer and a more difficult one to treat. So triple negative cancer is not fed by estrogen or progesterone or HER2, which makes it more difficult to treat because there are particular chemotherapies and targeted therapies that can target those things. So only about 15% of breast cancer patients are triple negative, and our prognosis is generally the worst of all of them. The best breast cancer to have is, I think, triple positive, the one that's called luminal A. In 2012, I was diagnosed and they wanted to get me in quickly for surgery. So I did a last backpacking trip to Yukon, which was wonderful, and then had surgery in September. I was diagnosed in July, had surgery in September. Would have been sooner if I hadn't insisted on going backpacking in the Tombstones. But then I had a friend's wedding in October, so I went to that in Mexico, and then my chemotherapy started in November. I had 4 rounds of docetaxel and cyclophosphamine, and then in April, when that was done, it was one infusion every 4 weeks, and in April when that was done, I had 31 days of radiation. So unfortunately, there was a lot of really big decisions to be made, really in July and August. And it was very stressful for me because, the decisions were, if you get chemotherapy and radiation, you will not be able to reconstruct this breast. So a lumpectomy with chemotherapy and radiation meant that I could not have an implant in that breast ever because the radiated skin simply would not accept it. Alternatively, I could have a full mastectomy and then I wouldn't have to have radiation, in which case reconstruction was a reasonable option. So I spent a lot of time researching and doing, looking at what the reconstructions look like, and they do not look like breasts. They call them breast mounts for a reason. It's a lot of surgery for what for a lot of people is an acceptable result, but for me, I thought it was pretty only a moderate result. Anyway, I was stressing a lot about having to make this decision very quickly. And ultimately, I finally made the decision when one of the nurses told me that, if you just get a lumpectomy, you might be able to keep your breasts for another 20 years. And then in 20 years, maybe there'll be new treatments. And so I thought, yeah, that sounds appealing, because I was single at the time. I was 46 years old, divorced and single, and I just could not fathom the concept of a mastectomy. So that's what I did. I had the lumpectomy and the radiation and went about my life. And I had no cancer for 12 years. So I was getting a mammogram every 6 months and an ultrasound every 6 months. So each of those things would be once yearly, but separated 6 months apart so that I get the maximum amount of screening. And so I didn't have anything for 12 years, which is really good for triple negative cancer. It tends to recur within the first 5 years. It's considered a grade 3 out of 3. Triple negative is almost always grade 3 out of 3, which means it's very aggressive compared to other cancers. So you tend to get it earlier in life because it is more aggressive. Anyway, that's my story from the beginning. There's a lot more to that. I was quite allergic to docetaxel. I had all kinds of rashes, difficulty breathing. I had one point when I was getting an infusion, I had pain and compression feeling in my chest, and the nurses had to rush over and pull the docetaxel out of my IV and put Benadryl in and monitor my vitals for a while. So yeah, being allergic to a chemotherapy drug is not great. There was a lot of rashes. I had difficulty sleeping by laying down because I'd feel this pressure in my chest. I had rashes on my chest. I had rashes at the actual infusion site. It was not a fun ride at all. So I was really happy to be done with it. Radiation's nothing compared to that. So this time around, it was caught by mammogram because I'm getting these 6-month screenings. So the mammogram saw something suspicious, and then they sent me for the ultrasound, and there was a doctor there for the ultrasound, which there usually isn't. And so she asked if I wanted to do a biopsy, and I said, oh yes, I think we know where this is going. And sure enough, the biopsy came back. I had triple negative breast cancer again. So this time, lumpectomy is not an option. This time I really had to get a mastectomy. It came back in the exact same place it was before. In fact, it was just right under the scar tissue of the lumpectomy. So this time I had to make the decision, but now I've had 12 years to kind of adjust to the idea of not having breasts. So I've had a good long time to think about it. And the decision, while it was difficult, it wasn't as hard as that first decision was. So I was given the option of a single mastectomy with reconstruction, could not have the silicone implant reconstruction, had to have a deep flap reconstruction. And so I did a lot of research and joined a lot of Facebook groups of people that had deep flaps and were very happy with them, people that had deep flap reconstruction and were not happy with it, had all kinds of complications. Like it's a major surgery. They'll tell you it's a tummy tuck that creates a breast mound. So they take some skin from your belly and some fat and a blood vessel, and then they mold it into a breast, and voila. You have a tummy tuck and a new boob. But that is very, very simplifying what it really is. So after doing a bunch of research and being in these Facebook groups where people had actual experiences and actual outcomes from the surgery, so helpful. Thank you all you people for sharing. I discovered that when they take that blood vessel from your belly, they actually have to dig through your stomach muscles, and the chances of them damaging your stomach muscles are actually pretty high. And I like to do a lot of stuff. I snowboard, I hike with my dog. Having damaged stomach muscles would be a big issue for me. So that was bad enough. But then they take that blood vessel and they need to connect it to a blood vessel in your chest. And to do that, they saw off the end of one of your ribs. Plastic surgeon did not mention this to me when I first met with him. I was kind of like, that's a pretty big detail to be skipping. So I'm just kind of like, wow, that's a lot of surgery. You're going to damage my stomach muscles, take a bunch of stuff from my belly, make a boob, cut through one of my ribs, attach this blood vessel. And, if it doesn't work, if that blood vessel doesn't connect properly and everything doesn't work, that tissue could die. So that has happened to people too. So I was just like, wow, that's a lot of surgery for, again, what I consider only a moderate outcome. So this decision was easier for me. I just said, no, I am not doing that level of surgery. No, for a breast mound. I'm not that committed to my breasts, and I've had 12 years to think about it, so I'm good. So I opted for a double mastectomy, and my surgeon was like, you don't need a double mastectomy, the other breast is fine. But I had, again, been on different Facebook groups of people who've had a single mastectomy, and, it's fine if you're getting it reconstructed, but if you're not, you have to wear a form a breast form, and that's awkward when you're swimming. Like, it moves around, and a bunch of the women who had had a single mastectomy, called themselves unicorns. Some of them really wished that they'd done them both. So I was just like, I was a double D, and kind of tired of having big awkward boobs because I like to do stuff, ride bikes and kayak and do all kinds of things. So I was pretty happy. Well, not happy, but I was pretty okay with a double mastectomy. So that's what I did. In June of 2023, I had a double mastectomy and was off work for about 6 weeks. It's a major surgery. So don't ever underestimate the amount of surgery that's involved in a mastectomy. You got drains. It's not pleasant. It's painful, of course. It's a major surgery, and yeah, some people get terrible results. When you have a flat closure with no reconstruction, it's called aesthetic flat closure. And there's a Facebook page called Fierce Flat Forward where people will show their results. And sometimes the results of these aesthetic flat closures are really not that great. They don't look like a flat closure, but mine is pretty good. I mean, it's not perfect. It's a flat closure, and then I had a lot of swelling and itchiness. So you have to release the scar tissue to keep it from sticking to your ribs. So I was doing that, but it really was remaining quite itchy and bothering me. So I actually went to physiotherapy for about a year and had her separate my scars from the tissue behind them so that they wouldn't be stuck to my ribs. And then after that, just massaging them and doing something called, oh God, I can't remember what it's called, but she used a metal thing to massage the actual tissue. And the swelling, that helped the swelling go down quite a bit. It's not perfect. There's still sort of a couple little swelly spots. And they do itch. So what I discovered is that I've got breast forms and a bra, and inside the breast forms of the bra, you can wear a lymphatic massage pad. And so when the scars start itching too much, I'll wear the lymphatic massage pad, and that solves the whole problem. Like, it doesn't itch anymore. I can wear that for a day, and I'm good for a couple days or a few days. And yeah, it's like magic. So again, you need to make decisions. You know what's coming. When you have breast cancer that's metastasized to different parts of your body, it's most likely to go to your brain, liver, lungs, or bones. So mine actually hadn't got there yet. They were in my lymph nodes. So my lymph nodes in my neck and lymph nodes coming down on either side of my throat. So from there, in the lymph system, it could spread to really anywhere. So it's considered stage 4. It's left the breast area. I really enjoyed watching Nicole's Staying Sane with Stage 4 Cancer, which was a blog that she did. She was a colorectal cancer patient, and she would just talk about what was happening to her. And it was just very real, very emotional, it was very, very helpful. It was just nice to see some of the things that can happen as your cancer progresses. So she had it progressed to her brain, and she ended up having some brain surgery. And I had been quite against the idea of having brain surgery. I just, if it goes to my brain, I don't know. I don't know that I want that surgery. But she had a couple of surgeries and some radiation to her brain, and she was really fine, like mentally fine. Of course, it's difficult. You have all kinds of complications and problems, but it didn't damage her motor system or her thinking, and so that kind of helps me. That helps me to decide that maybe when the time comes, maybe I would get brain surgery. And then a neighbor across the street got brain cancer, and he had brain surgery. He had quite a huge scar from here down to here, and after it, he was, again, just mentally fine, physically tired, of course, but it didn't do the damage that I thought it would do. So now, after seeing that, I think my decision for brain surgery would be, I can do that. So at the moment, like I said, I'm doing really well. I started on a drug called paclitaxel. So there's different lines of treatment when you have stage 4. Your first line is the one that they think is going to work the best. Your second line is when your first line stops working, is one that they think might not work as well. And then your third line is one that probably doesn't work as well. And then your fourth line is probably the last option for you. And after that, you're just probably not going to get any more chemo. So I started on paclitaxel. I was on it for about 4 months, but it gave me really bad neuropathy. So did the docetaxel the first time. The first time, the docetaxel gave me such bad neuropathy that I couldn't do up buttons or fold socks. It's quite painful. It starts off with numbness, but then it becomes painful in your fingertips and toes. Yeah, all my fingernails fell off. So after chemotherapy, they had to all grow back, all my fingernails and toenails. But that didn't happen this time. They didn't even go brown, which is good. They started to go brown. But anyway, since I had that history of neuropathy with the docetaxel, my oncologist backed off the dose of paclitaxel, but it didn't help. I still kept getting neuropathy. So I was only on it for about 4 months, and it had reduced the size of my lymph nodes by 40 to 60%, depending which lymph node it was, which wasn't bad. But I just couldn't do it anymore. I couldn't tolerate it anymore. And there were other things like really bad mouth sores, brain fog. There was an hour or two where I couldn't remember what I was thinking 10 minutes before. So I had to quit work. You can't work if you can't think. I'm a geologist, so it requires a fair bit of thinking. I have to make maps and write reports and things. So yeah, I ended up quitting work. Then my second line was Trodelvy. So like the nurse had said years before, Trodelvy was a new drug. It had only been approved after clinical trials, like maybe 2 years ago, 1 or 2 years ago, not very long at all. So it is a new drug, and it's a good one. It has very little side effects. It's certainly no neuropathy. It's not known for neuropathy, whereas paclitaxel and all the taxanes are. Just really, it's a lot of gastrointestinal issues. So it's basically constipation on the first day, followed by diarrhea whenever it feels like coming. So you have to take different pills to manage that, and you take a lot of pills on chemo day. I'll show you that another time. So you're spending your first few days after chemo managing all your gastrointestinal issues. I still have a bit of remaining neuropathy from the paclitaxel. It doesn't seem to be going away. I still have numbness in my fingertips and toes. So I hope it'll go away one a day, but maybe it won't. But I don't have any brain fog. When I do have mouth sores, they don't even hurt, so they don't bother me at all. The only downside is that I'm gaining weight, so I think it's the side effects of the dexamethasone I have to take for the first few days of chemo, followed by the next 2 days. It'll probably set me in good stead in case I get on something that causes me to lose weight in the future, I suppose, but it is annoying. Oh, and also I have a lot of head itching, so I don't wear wigs very much because part of my symptoms from either the chemo or all the drugs I take, I don't know, is that I have itchiness around my neck and in my head and partway down my chest and a little bit partway down my back. So I've managed that by showering only every day and a half instead of every day. That seems to give my skin time to recover and have its own oils and feel better. And then I exfoliate like crazy, especially my head. I can exfoliate actual 3 layers of dead skin cells off my head every day. It's in my neck. It's unbelievable. So I have to exfoliate it off and I have to moisturize it. So I've tried hydrocortisone. I've tried a few other things, and nothing really, really manages the itchiness. So I make my own moisturizer, and I had remembered that a friend of mine made moisturizer. We made moisturizer together, and she put some CBD oil in hers to give to her sister for her eczema. So I was like, if that worked for the itching and the eczema, maybe I'll try it. So I had the CBD oil left over, so I made my moisturizer, threw some CBD oil in there, and now I just use that for my head. And actually, it does work. It is, my itchiness is way better. So now I'm thinking, well, let's buy some wigs. Maybe we'll wear more wigs now. I do still wear a wig, but you can see me when I'm wearing it. I'm just like, So itching is a problem. I have to wear something underneath it. I have to wear a cap underneath it. There's no way I can put a wig right on my head. Just no way. So anyway, I'm ever hopeful that now that it's not so bad, I might start wearing wigs. Anyway, that's it for the first vlog. Happy trails, and I will talk to you again.